welcome in today. We're here with our Healthcare Solutions Steering Committee. My name is Chad Burke with the Economic Alliance Houston Port Region, and we want to talk to you through our brand new committee on healthcare in the workplace. And I want to introduce you to our steering committee. First, I want to tell you a little bit about how this came about. This committee was formed with the mission to create awareness of all of the different healthcare options that we have in the region for our companies and how that serves the workplace and employees and all kinds of opportunities to engage in healthcare, and how we as an organization can better communicate that to all of our members and then help those companies and their employees as well. Just a little background on that: we pulled this committee together and we identified a few topics through a survey that member organizations of ours, member companies of ours, are interested in talking about. It includes things like wellness education, where do I start on that? Building relationships with a primary care provider or physician is really important. And then proper utilization of urgent cares. What happens when an accident? I've been in urgent care with my grandson, right? And so what do you do? Who do you call? Where do you go? That type of thing. And then preventative care and screenings. How do we get ahead of health issues so that we don't have to face more significant health issues down the line? And then occupational health, injury prevention, recover, care, and education. All of those are key topics that were fed back to us from our members in the survey, and we've got the organizations that can provide all of those answers here on our steering committee. And now I want to take the opportunity to introduce our steering committee. I'll start to my left here, Nellie Baktashi with Houston Methodist. Why don't you give us kind of the brief overview of Houston Methodist and some of the things that you and your team of experts will contribute to the topics and the events that we identify and use coming into 2023.
Sure, awesome. Thank you so much, and thanks again to all of you for making the time and for giving us this opportunity to really educate our community and really be their voice on top of provide a vehicle for all sorts of education for them. Houston Methodist, I'm sure you guys are familiar with. We have about 8 hospitals in the community, so and with the newest one in Cypress going up, so we are really a community-driven system. And with that being said, we also have about 30,000 employees of our own, so a lot of the things that we find and look into, we have already kind of implemented that with our own group first. So it's a lot of tried and true sort of educational pieces and findings. And as you mentioned, it's really important. Healthcare is not only just a benefit anymore. It's one of those things that really can make or break a company and their not just the company, but also their employees, and their employees of each company, of all these employers, are truly our community in a sense. And at Houston Methodist, we work with over 450 employers, and that means just really everything that you mentioned. Those are the educational pieces and the resources and the demands that folks need in our communities. And as part of the Employer Health Solutions team, that is kind of my role, to sit down with employer executives and their HR teams to really understand their needs, improve their access to healthcare, really help their employees navigate through our system. As we all know, the healthcare system is very, very tough to navigate through at times, and and also just kind of bringing it full circle with offering wellness services and screening tools and different ways to really make sure that the patient is taken care of, from head to toe, and they don't have to ever, worry about where to go next and what to do next. So wellness education and programming, like I mentioned, we have our own wellness programming for our employees, and so a lot of the findings and a lot of the tools and resources and experts we have, they've already implemented these wellness tools and educational vehicles, and so they can actually talk on how not only what those are, but also how they impacted our own employees. And then importance of building a relationship with the primary care. Primary care doctors are just, the one thing that we found out with COVID pandemic was how many folks don't go to their primary cares, or how many don't have a primary care doctor. And that is just so important, because if you don't know what's going on with you, and a pandemic happens and you're not sure where you stand when it comes to that, it's really tough to navigate from there. And it's just nice to kind of have that relationship, somebody that knows you throughout your life, and that way if anything happens out of the ordinary, they're the first ones you call, and they'll be able to help you better rather than starting from zero. So and then proper utilization of care, that's just one piece that I think it's a lot of that has to do with just making sure employees know what's the difference with going to an urgent care or an ED, emergency department, for a cold or flu, whereas you can go to your PCP for that, or vice versa. What are those different kind of symptoms that can be resolved with a virtual urgent care platform, rather than going into the office to kind of, or the clinic to get seen for those things. Obviously, if you're bleeding, we want you to go get seen, but if you're not, and there are different ways that we can educate and make sure people are aware of what sort of vehicle they can use. Preventative care and screenings, we kind of talked about that. The one thing that we've been able to find is kind of the delayed screenings with COVID, and how that happened with those couple of years that,
right.
It was
People put off going
gosh,
and getting
and the more you do that, the chances of you being stage 1 versus stage 4 is very, it's impactful on not just the individual, but also on the company who's going to provide the care and the foot the bill for that. And then occupational health clinic, we have our occupational health clinic in Baytown, but also one thing we were able to look into was that a lot of folks that go to the emergency department or are on workers' compensation care, they have pre-existing injuries, and a lot of that just comes into effect and comes to light when they get injured on the workplace. So it really prolongs the care and recovery afterwards. So what we were able to do was pull our athletic training team and make sure that they can utilize their services, their expertise in a non-traditional format, and really offer injury prevention and make sure that they're educating folks on that. So we will be able to kind of in the next year and the years ahead, hopefully through this committee, to bring in experts to talk about those, bring in findings, statistics, to really just shine light on a lot of these issues.
Yeah, and that's a good point. I may not have made that point clear enough. So really the goal of the committee is to put this information in events in front of our members. Healthcare in general is a little bit confusing, right? There are a lot of options and a lot of terminology that you're just like, okay, it's not every day, right? You guys are in the business, right? So we're going to use you guys and your teams as the expert to bring that knowledge, in layman's terms, so I can understand, what's best for our employees, right? And so I think it's going to be really valuable. So now, Melissa, with Kelsey Seybold, why don't you tell us a little bit about Kelsey Seybold and kind of what you're looking for here and how y'all are going to help us.
Sure, my name is Melissa Mohammed. I am the clinic administrator for the Pasadena Kelsey Seybold Clinic. That's one of many in the Southeast region. So what I do there is I just manage that clinic, and we kind of coordinate with different clinics in the region as well as the hospitals in our region as well. But we're an ambulatory care clinic, so we do treat almost everything that we try to prevent you from going to the urgent care. That is really our mission. And so, you can come.
See, you've already used a few terms that I'm going to need some definitions on.
Sure.
Ambulatory care.
So,
you don't have to do them right now, but I'm going to definitely have to understand these terms. But keep going. I don't mean to interrupt.
Sure. No. So, basically, that just means that we're an outpatient clinic.
I got you. See, layman's terms.
So, I really want to touch on the education of proper utilization because we do have a lot of patients that may come in and tell us that, you know, they do have shortness of breath or something like that. Stuff like that really needs to go to the ER or the urgent care because we're not equipped to deal with that. And we just want to make sure that they get the proper care. But, you know, if you sprain your arm or if you have a cold or flu, we're going to see you. And at Kelsey, we have after hours care as well. And we actually have weekend care as well. So we try to prevent, you know, your employees from going to urgent care for something that we can take care of in clinic. So I'm going to touch kind of on like primary care. So we do recommend establishing care with a primary care provider, and that may be a family medicine physician or provider or internal medicine, and that's so that you have a baseline, right? So when something comes in up in the middle of the night and you're like, oh, I need to go to the doctor, we do have virtual care that you can do after hours like that. But if you have established care and had a physical within the last year and you have a baseline, when they're treating you, it's going to be a little bit easier,
Sure,
right?
sure.
So that's why we do recommend doing that first. But we do, you know, for virtual care, you can really do almost everything at this point. You can follow up on your chronic conditions such as diabetes, high cholesterol. You can do GI issues, urinary issues. So obviously after the pandemic, it became very prominent, virtual care.
I heard, yeah,
yeah.
I heard that went from a small percentage of the business to just a large
Correct.
percentage of the business.
Correct.
Now,
And
right?
it
How much
also
more convenient and easy that is.
Yeah, and it also became, you know, and I'm just gonna use my parents as an example, but they didn't understand virtual care either,
Yeah.
right? Because they're not really tech savvy, so I had to teach them how to do it, and now they do their visits virtually, and it's very convenient for them. So I think it's also about education and
Yeah.
knowing that it's there.
Exactly.
So, but yeah, I think that's what I'm gonna have
Fantastic.
somebody come in and, you know, I'm gonna have a professional come in that knows a little bit more and can discuss, you know, what can be virtual and what does need to actually go to the urgent care.
Excellent,
Yeah.
excellent. All right. Now we'll switch over to Jennifer Almaguer with Community First ER. Tell us a little bit about ER work.
Yes. Okay. So yes, we are a local emergency room here in Deer Park, and there is a difference between an emergency room and an urgent care, and a PCP and the virtual. So
I need to know all of the differences.
yes. So we are just emergency room. Yes, and we're open 24 hours a day. 7 days a week, 365 days a year. We're open every single day of the year. So I really just want to emphasize on that, especially around the holidays. You know, things happen, and we just want to make sure that our community knows that we're there. And we're family owned and operated. So I don't know if any of you have ever had the chance to come in just to come visit, not because you've been a patient, but it's a very home-like feel. That was the goal of the facility when it was built, is for it to feel a little more home-like. And our medical director, Dr. Radhasham Miryala, he's an expert in meditation. He has really great topics on how to prevent a lot of illnesses, and he gives a really great talk on the importance of sleep and how that plays into our wellness and longevity, and it has a domino effect on if we're going to show up to work, and how are we showing up to work. Are we being productive? Are we being sluggish? Are we wasting time? Because all of that will eventually compound and not help the economy, essentially, at the end of the day too.
Sure.
And one interesting fact that I learned through the importance of sleep, and why he focuses on this topic, is that the human body will give up from lack of sleep, from sleep deprivation, before anything else. So I really love his educational speeches, because it really brings us back to the root of what's really important. And we all know sleep is important, but he really breaks it down in the way that it kind of, you internalize it a little bit more on a deeper level. And every time he gives this speech, there's people that they become alive again, and they're making plans on how they're going to prioritize their sleep and really create the changes around that. because like I said, it creates a domino effect, and he has a really great topic. So I'm really looking forward to having our medical director educate our public so we can all stay healthy and happy and live good lives.
Very good, very good. All right, next up is Matt Gary, Public Health Policy Advisor from Harris County Precinct 2. Matt, tell us a little bit about how Harris County is helping out in healthcare.
Absolutely. So for us, I work for Commissioner Adrian Garcia, and so he represents Precinct 2 in Harris County. There's 4 commissioners and a judge who make up a commissioner's court. And so for those of you who aren't local government nerds, basically what a commissioner's court does is they allocate the money and the funds that go towards particular programs to help serve the community. And so we're working with a few $1 billion a year. And fortunately, the current makeup of Commissioner's Court prioritizes expanding access to health care, and it's only gotten better after the last election. So we're excited about that and to work with the partners here in this room. And so we go about providing access to health care in a few different ways. The first one is through our government hospital district operated by Harris Health. Second of which is through the Harris County Public Health Department. And then also within Precinct 2, we have our own health services division where we've had to get really creative on how to expand access to care. Basically what we're doing is trying to make sure that the uninsured and underinsured population is still able to access healthcare services. And so the biggest gap in that comes from the state of Texas deciding not to expand Medicaid. And so we've got about 220,000 folks in Harris County who would have health care if the state were to expand that. And so we've had to get creative on solutions of how to counter that issue. And so one of the ways that we've done that is through our partnership with Baylor College of Medicine. And so back during the Ebola crisis, they wanted to go to remote parts of Africa and help make sure that they were responding to this crisis in form. And so how they did that, and this is really cool, I get excited talking about it, they use old recycled shipping containers and transform them into medical clinics. And so Commissioner Garcia saw that and was like, hey, let's do that here in Harris County. And so he got 2 of these mobile medical clinics, one of which is in Pasadena, another one is in North Houston and Aldine. And so these clinics are free for any resident of Harris County. They can come and get primary care medical services. And last month we also opened one up. And that is exclusively being used for mental health care as well. And we're hoping to get some more federal funding to expand these all across the county as well. And so we've been talking about experts that we're going to bring in future podcasts. So I'm hoping to bring someone in who can cover the importance of vaccines. Flu season is here. It's hitting in full force.
Yep.
Yes.
And so we want to encourage everyone, employers included, to make sure we're disseminating that information, whether it's through an email blast or advocating that everyone go out and get their flu vaccine, COVID vaccine, and any other immunization that they may need as
Very
well.
good, very good. I have to tell a quick story that where worlds collide between healthcare and county politics and economic development. So right after Harvey, one of our hospitals on the north side closed and left really a dearth of healthcare providers on the North Channel side of our footprint. And Commissioner Garcia came to us and said, hey Chad, can you go out and see, do what you guys do best, which is bring businesses in to these to this region. And so we went out, we talked with several of our health providers. Kelsey Seybold was one of them, and we said, look, would y'all consider doing anything in this footprint right there? And the first was like, well, we hadn't really considered it, right? But it prompted them to take a look at that marketplace, which ended up spurring the creation of a clinic right on the north side to try and help fill that. So that, and then you can see the continuation of what Commissioner Garcia in Precinct 2 has done with these mobile clinics that he's brought out. So it all really kind of fits together: economic development, bringing business and capital investment, providing information to those companies so that they can do what they do best, right? They can take care of their employees can make their widgets, produce their petrochemicals, whatever it might be, and create jobs and economic activity that really creates a vibrant regional economy, which is our goal, right? So you guys play a huge part in that. I'm really excited. about the opportunities to bring these topics and these experts in front of our members, whether it be in this setting, whether it be lunch and learns, whatever it might be. I'm really excited. I appreciate you guys' commitment to it, and we love the fact that y'all are members of the Alliance and using the Alliance to push that information out and make this region a better place. So with that, we'll say thank you, and we'll see you soon in 2023. Thanks.
Thank you.
Thanks.